Yeah, well, we've been spending a lot of time on this with a large number of people, and we'll have much more details coming later this week. But I will say that we all need to, there are many unknowns around this virus, and we have seen that. We've seen what's happened all around us, and we know that we can't be complacent. So it is important for families to be flexible and for workplaces to think about being flexible as well as we come into the fall. I will say we have done a lot of looking at what are the unintended negative consequences of children not being in classroom learning situations. And we know there's tremendous impacts on emotional health, on mental health, on other factors around children's ability to socialize and to learn. And that's why it is so important, and we're putting so much effort into making sure we can do this in a way that supports all children and their learning needs in the fall. And those vary by age of children as well. So these are things we all need to think about. We'll have some more details about what we're planning in the system coming up, as you say, later this week. But I think we all need to understand that we've not been through this before. We've not, at least most of us have not. There are a few people who are over 100 who have been through something very similar, but they probably don't remember it. So we need to learn together, and we need to plan for all contingencies. As we've said many times, when this virus is anywhere, we're at risk everywhere. So we need to pay attention to what's happening around us as well. But I do think that there is absolutely ways that we can get almost all, hopefully all, children back into an in-class learning situation in the fall, and we're going to be planning towards that.
Do you have a follow-up, Sarah?
Yes, definitely. So would you consider making masks mandatory then for children and teachers? And if not, why not? And if you don't mind doing that in French as well.
So, I've said this many times as well. Masks are an additional layer in certain situations, and I don't see making masks mandatory in school settings being a reasonable approach right now, at least from the evidence that I have seen. I do think there are some situations where masks would be helpful, particularly on transit back and forth to school, in some of those situations where you may be in close contact, not able to keep the physical distancing, so in transitions perhaps in hallways. I also think we need to remember that much of the transmission that we see in workplaces and school settings is between the adults in those settings. So there might be a role for masks in areas where adults are together, where they, I'm thinking of break rooms and things, where they may not be able to maintain their physical distancing as well. But at this point, there's no intention to make it mandatory, and certainly not in the in-classroom situations for young children. Yeah, absolutely. And that's one of the things that we're looking at. How do we create those cohorts where you have the contacts, but you minimize contacts with others in the school? So those are the options that we're looking at, because that's really the only practical way to do it. And it needs to be done differently for different age groups of children. So more details about that will come out. But absolutely, we've looked at that in people having work cohorts. We're having small numbers that you stay with on an ongoing basis, that we know we can connect with. We know who it is that you spend your time with. And so if a case arises, we can effectively care for people and isolate people if need be. I think all of us are worried. All of us don't know what's going to happen. We all have anxieties, and this is why we all need to learn as we go. We're making adjustments as we go. We learned quite a lot about what works and what doesn't work in June, and that's put us in good stead for making sure we have plans for the future that are the safest for all involved, including teachers. And absolutely, we all have some anxieties about going back full time, but I think we need to address those. We need to work together on making sure that we have things in place. And we've not done COVID before, but we've had outbreaks in our school systems before. We know how to handle those, whether it's measles, whether it's influenza, chicken pox, pertussis, meningitis. There are many things that happen in our congregate settings, particularly in school settings, and we can manage those efforts together. And we need to do that through this pandemic. We know that there are many downside impacts on children in particular, but when they aren't in a school setting, and those can last a lifetime. So we have to balance our risks and make sure that we're as prepared as we can be and as safe as we can be for everybody. But, this is a new thing. None of us signed up for having a pandemic, and we all need to adapt and make sure we have everything in place to adjust and to support our school communities, our learners, as well as our educators as we're going into the fall. And that's what we're going to be doing.